This is Elise Hull presenting my video study comparison for Health History 201, and my research question is what incentives, if any, increase maternal desire to access care? So these are the two studies that I did. The first study, which will be referred to as the Kenya study, was titled Traditional Birth Attendant Reorientation and Mother PAC Incentives Effect on Health Facility Delivery Uptake in Narok County, Kenya, an Impact Analysis. The second article is called The Impact of Monetary Incentives on Referrals by Traditional Birth Attendants for Postnatal Care in Nigeria. The research problem for these two studies. For the Kenya study, the purpose of this qualitative study was to estimate the impact of two interventions, the first being a cash incentives for traditional birth attendants to refer clients to transport to a facility, and the second one was a mother pack given to the mothers after they delivered at a facility. The Nigeria study, the purpose and problem they were finding data on was to create an individually randomized control study, which was to estimate the impact of cash incentives for traditional birth attendant referrals and the effect on increased maternal and neonatal postnatal service use. The referral had to be within 48 hours of delivery. So this was for postpartum care, whereas the Kenya study was for intrapartum and perinatal care. The study design for the Kenya study, this study assessed the outcome variable of monthly facility delivery data from 28 health facilities from January of 2013 to December of 2015. So that's 35 months, and the data was collected each month over those 35 months. This data consisted of a starting month for each of the two interventions at each of the 28 facilities. A negative binomial generalized linear model framework was applied to the model and the relationship, and then all variables were measured as count data and were over dispersed. All analysis were conducted using R software. For the Nigeria study, this study conducted a non-blinded, individually randomized control study of 207 traditional birth attendants in Ebonyi State, Nigeria, and this took place between August and December of 2016. The traditional birth attendants were randomly assigned with a 50-50 probability to receive $2 for every maternal client that attended postnatal care within 48 hours of delivery, which was the intervention group, or received no monetary incentive, which was the control group. And this $2 is the local currency. It's not $2 in U.S. currency. So this data was compared, the probabilities of maternal and neonatal postnatal care within 48 hours of delivery and treatment and control groups in an intention to treat analysis. In addition, the study assessed if the care received by mothers and newborns during these visits followed the World Health Organization guidelines. More on the study design. In Kenya, there was a little over 9,000 women that delivered at the health facility. There was a total of 408 traditional birth attendants that were reached, and over 2,000 mother packs were distributed over that 35-month analysis. In the Nigeria study, it was a shorter study because it was also analyzed over a shorter time, but there was 207 traditional birth attendants that participated, and that included traditional birth attendants that lived in that ward. That was part of the criteria. What the studies found was that there was significant uptake for the Kenya study and facility deliveries when both interventions were implemented together instead of singularly. The mother packs had the greatest uptake, followed by TBA's cooperation. In addition, the analysis provided some evidence that far more positive results were obtained when traditional birth attendants were co-opted into a system rather than outdated and criminalized. The study findings for the Nigeria study was that there was monetary incentives for traditional birth attendants can indeed increase the use of skilled care postnatally and better care for recently postpartum mothers and newborns. The analysis of this, the internal validity of the Kenya study, I found to be low to moderate. This was due to the fact that there are two variables being assessed and the factors influence one another pretty highly. The external validity of the Kenya study was very high. There have been several studies assessing interventions with mother packs and traditional birth attendant referrals in several different locations around the world. For future research, I recommend something that I think would be neat to look into is continue to research exploring the relationship between these interventions and if similar results would be repeated in another context. For the Nigeria study, the internal validity was low. The study design was reliant on self-reports from clients on early postnatal care attendance instead of facility records comparatively to the Kenya study. The external validity is moderate. There are a few studies assessing the traditional birth attendant referral during the postpartum period and its effect, but there's not as many as the Kenya study. For future research, I think this needs to be continued in other cultural contexts and also elongated. Thank you for listening to my presentation.